So in this video we are going to talk about ULNT, upper limb neurodynamic test, or ULTT, upper limb tension test. These tests are very similar to SLR, straight leg raising test in the lumbar spine. All this neural test where you stretch the neurological tissue and you stretch all the tissues. But how you can differentiate that it is a neural tissue by adding the sensitizing components, tensioners and sliders. And the next thing, sensitizing component is a cervical spine. Cervical spine is an interesting part because when you check the straight leg raising test, cervical spine can be a sensitizing component. But when you check the upper limb tension test, contralateral side cervical flexion can be a sensitizing component. Of course, you check the good side first and then you come back on a side that is affected. Now there are two joints that are most important when you check the ULTT. First is shoulder. Shoulder should be in depression all the time. Even when you take the shoulder in abduction, maintain the depression, because if you don't maintain the shoulder depression, the results are less likely to produce. Second joint is an elbow joint. Elbow joint is important because elbow joint has a greater range of motion, easier to measure. Third, easier to measure the improvement. So you come on the, you place all the joints, shoulder, forearm, wrist and fingers and thumb, but the last movement you performed is the elbow range of motion. Davis et al. Suggested that if the symptoms will produce before 60 degrees of elbow extension, that means the ULTT is positive. Upper limb tension test can reproduce the symptoms faster compared to the lower limb tension test. So ULTT will reproduce the neurological symptoms easier compared to SLR. There are some contraindications where you cannot perform the neural tension test. If the number one, if the patient has lesion in the cauda equina, number two, if the patient has lesion in the spinal cord, or number three, if the patient comes to your clinic in an acute phase of injury where it's a fresh case of radiculopathy, do not check the neural tension test, because where the nerve is pinched at one side, it's not a good idea to stretch the nerve at the periphery. Now, LV describe the ULTT in 4 parts, ULTT 1, 2 and 3 and 4. But the other rehab specialists like Butler, Shacklock and Maitland gave their greater contribution in upper limb tension test. Now, upper limb tension tests are interesting because elbow extension will put greater stress on radial nerve and medial nerve, but elbow flexion will put more stress on ulnar nerve. Same as wrist extension will put more stress on median nerve and ulnar nerve, but again releases the stress on the radial nerve. Now, we'll talk about ULTT first. So ULTT first is shoulder depression and abduction about 110 degree, elbow extension, forearm supination, wrist extension, fingers and thumb extension. Nerve bias it checks is median nerve, anterior interosseous nerve, with the root value of C5, C6 and C7. You can of course put the sensitizing component is contralateral cervical side flexion. Coming back to ULTT2. So ULTT2 is shoulder depression and abduction about 10 degree, shoulder lateral rotation, wrist elbow extension, forearm supination, wrist extension, fingers and thumb extension. The nerve biases median nerve, musculocutaneous nerve and axillary nerve. The sensitizing component can be contralateral cervical side flexion. Coming back to ULTT3, where shoulder depression and abduction about 110 degree, medial rotation, elbow extension, forearm pronation, wrist flexion and ulnar deviation, fingers and thumb flexion. You check the radial nerve. Some suggest like you put the thumb inside and then put the fingers outside and then flex. We'll check the radial nerve. ULTT4 checks the ulnar nerve, where shoulder depression, abduction from anywhere between 10 to 90 degree, lateral rotation, elbow flexion, forearm can be supination, pronation, wrist extension and radial deviation, fingers and thumb extension, and you check the ulnar nerve with the root value C8 and T1. Now, how you can differentiate that a ULTT test results are positive or negative? So positive is pathological, negative is normal. So how you can say that this is normal or the test results are negative? So the patient will stretch or deep ache in anterior shoulder, cubital fossa, forearm, and a radial aspect of the forearm, or even the tingling sensation in the fingers, according to which nerve examiner is checking. Again, there are some other things that you can tell that this test results are normal. When contralateral side flexion on the opposite side tested will increases the symptoms, and ipsilateral cervical flexion will reduce the symptoms. This all will say that the test results are normal, it's negative. How you can say that the test results are positive or the patient has a pathological sign? So very important, most important is reproduction of signs and symptoms. One more time, radicular symptoms. Second, when you add the sensitizing components like tensioners and sliders in the ipsilateral quadrant, will reproduce the symptoms one more time. And the third and very important is patient will feel abnormal sensation in two different extremities. Right is more than left, or it can be left is more than right. Thank you.